Hello, friends. It's been a hot minute since we've talked about COVID, but I want to talk about COVID again, mostly because I think it is underscoring a lot of the things that we are currently facing in a myriad of ways that I don't think we are fully comprehending. So let's dive in. So we keep talking about COVID as if it's in the past tense, but it is very much not in the past tense, because the most profound part of PMC's charts, thank you, Dr. Mike, is how high the space is staying in between waves. That means that more people are getting infected more frequently because we are ignoring COVID and pretending it's in the past tense, pretending it's a cold, not testing, not isolating, not masking. And all of that matters because every reinfection is causing long-term damage to our body. Some of it might appear silent for now, but that doesn't make it any less devastating. This includes cumulative damage to the brain, which may be why people say, I feel different, I feel slower than I used to be, why people are quicker to rate, why we have more car accidents, and perhaps why we are more susceptible to propaganda, because it damages the part of the brain that's responsible for emotional regulation, memory, executive functioning, and critical thinking skills. It damages the heart, even in children, and children are getting infected at some of the highest rates out there because schools are doing absolutely nothing to prevent transmission. And these aren't small studies. We are seeing a rise in the number of adults with long COVID. 35 million adults, 30 million of whom are working age, or 1 in 7, losing hundreds of billions of dollars worth of wage. And of course, even though we're no longer allowed to study this because these are banned words, there's absolutely a racial and economic disparity in who suffers. Frontline work, people who are under the poverty line, people who are already marginalized, are more likely to be impacted. It affects the salivary gland, which in turn affects the immune system. It causes cellular aging. So yes, in fact, you feel older now, probably because you literally are older on a cellular level. It's reducing our brain volume and forcing our brain to rewire itself in order to recover. I mean, that's a good thing. That means our brain is trying. But repeated infections or severe infections or chronic infection make it harder for the brain to heal, leading to greater cognitive impact. It's literally making us sicker, increasing the risks of all other infections for at least a year every single time we get COVID. And yes, significantly increasing those risks, which is driving the increase of things like invasive strep A, which has shown a clear rise since we let COVID run rampant in schools. So when you heard about this explosion of cases in Europe and in the US, it's not a coincidence. It's the damage that COVID is doing to our immune system. And this one, especially because so many people gave me flack for talking about it when it was happening, but that mysterious hepatitis outbreak that was happening in kids back in 2022 that everyone swore up and down wouldn't possibly be associated with COVID-19. Yeah, it in fact was caused by COVID, not adenovirus. So much so that it's now being dubbed long COVID liver. But here's the problem with framing it as during COVID and post-COVID. You frame it as a past tense problem, not an ongoing problem. So then people seek to find other things to blame for these obvious different problems that we're experiencing. Like, it was not normal to be sick all of the time before 2020. It just wasn't. This always being sick with mystery illnesses, that's fucking new. But we've so damaged the parts of our brain that deal with memory and critical thinking that people literally can't comprehend this anymore. They think about the world like this instead. But more people have been sickened and killed here in that entire period than here. So instead we pretend like it's normal, and kids are paying the price through getting long COVID, through punishing truancy at record levels, even when those kids are out for being sick all the time, because COVID has damaged their immune systems, and they're going to be susceptible continually. Kids aren't missing school because the brief period of closure trained them to not want to go to school anymore. They're not going to school because they're fucking sick. And it's not a mystery either. It's in their own fucking data. The majority of these increases of absences are caused by authorized illness absences, meaning they saw a doctor. Now, there are some good things on the horizon. There are potential long COVID treatments on the horizon, although this was before Trump and our idiot secretary gutted the HHS. There's also a new trial for long COVID underway in the UK. We could be doing things differently because masking, testing, and isolating do work. This study showed how if we had done more asymptomatic testing earlier on in the pandemic, we could have significantly reduced the number of excess deaths. And we could still be making that choice today, but we're not. We could be cleaning the air in public spaces, especially in medical facilities, which would not just protect from COVID, but also measles and a myriad of other diseases. Because this study showed that HEPA filters in room cut airborne COVID by 98%, which means a small change can significantly reduce the air viral load. Because yes, it can transmit through ventilation, even in long distances, if it's not clean. So why aren't we doing that in schools, on public transit, in hospitals and doctors' offices. There's no reason that we can't be. But again, by pretending COVID is over, we are refusing to acknowledge an actual ongoing problem. Unfortunately, our Secretary of Health and Human Services is only going to make this worse because he's actively blocking the full approval of Novavax, even though it is extremely effective, simply because he doesn't believe in any vaccines. He's not just questioning the science about some vaccines. He does not believe in vaccines at all. And vaccines save lives, millions of them, every single year, including saving us from COVID. Does it prevent long COVID? 100%? No. Does reduce the risk. Does it prevent the chance that you'll ever get COVID? No. But it definitely reduces your risk of severe illness, hospitalization, and death. It is one layer in a layered approach to prevent transmission. But the other approaches are cleaning the air, wearing a mask, staying home when you're sick. It's not one of these things, it's all of these things. Because every infection you prevent is protecting yourself. Because here's the dirty truth. The day where someone is dying of COVID once every 3 minutes, that's today. And that's not just mumbo jumbo. That's predictions from actuaries whose entire jobs focus around analyzing data about risk. They expect that there'll be 175,000 COVID deaths in 2025. That's 479 per day, 20 per hour, or 1 every 3 minutes. In addition to the cumulative damage of the ones that survive in long COVID and in lower life quality from that repeated damage. Even still, that's akin to the number of people that die of lung cancer every single year. So when I say that we're all sicker right now, I mean it in a literal sense, but I also agree with Dr. Lin. I'm convinced that the unwillingness to collectively acknowledge its impact at societal level eased us all into a state of apathy that increased our tolerance to the unacceptable. Abandonment of vulnerable people is often a breeding ground for the normalization of anti-democratic ideas. I am a lover of history, and I was always fascinated with the 1920s and 1930s, about how the entire world could seemingly lose their mind simultaneously. I don't wonder that anymore. I think history is on repeat. Back then, the 1918 pandemic, coupled with a horrific world war, led to global apathy and damage to parts of their brain that affect empathy and critical thinking. And I think COVID has done the exact same thing, except we're allowing it to continue to repeat, getting slightly worse each time. When it came out, I thought Idiocracy was an incredibly stupid movie. But more and more, I think it was actually a predictive future documentary, one that I didn't want to be living, but here we are. COVID is not over. It is making everything worse. You need an active, functioning immune system for your previous vaccines to be effective, making all things worse, including susceptibility to a measles epidemic. The best things that you can do are prevent every infection that you can. And you do that by cleaning the air, masking, staying home when you're sick, and staying up to date on your vaccines. There is no magic solution. I know we all desperately want it to be the normal that we had before 2020, but that normal is gone and dead. We need to bury it and mourn it and figure out how to live in the reality that we actually live in now.